This is a podcast from So Wrong It's Right with Olivia Attwood, and it features Ashley and Lauren from the Nip Tuck podcast talking about getting a facelift in their 30s. Let's react.
You and I have a shared passion for cosmetic surgery and everything related.
We love it. Plastic surgeon's dream, right? By the way, most people who come to me for cosmetic surgery, they have like a specific goal in mind. They're not usually there for, lots and lots of different procedures. And to me, that's always a red flag when someone's asking about like a laundry list of procedures, right? Because then it's like, are you trying to turn into a whole different person? That to me is a problem. I think people have the right to express themselves and to get certain things adjusted where it maybe has been bothering them for a long time. But people chasing some sort of ideal and going for a ton of surgeries, I think should be a red flag for any plastic surgeon.
Where's that passion come from? Obviously, you worked in the clinic together. Mm-hmm. You've always had an interest.
Yeah. So I remember when I was younger, I lived opposite a cosmetic surgery group. And I always used to say to my dad, like, what is that? And he was like, people go in there and they come out looking like a different person. Oh. And then I was just fascinated with it.
But you see, this is where there's like a divide, right, in the field, right? Some people are going for plastic surgery and coming out looking like someone totally different. That really, in my mind, is not the goal of plastic surgery, especially cosmetic plastic surgery. I think it should enhance your existing features and not turn you into someone completely different. So if people don't recognize you after the surgery, that to me is a problem. I think people might see you after good plastic surgery as being more refreshed and looking rested. That's good feedback to get after surgery. But when it's obvious that things were modified and changed and the cheekbones look crazy and the eyes are crazy lifted, I mean, that is usually not a sign of surgery done well, right? And I think people have a misconception now of what good plastic surgery looks like. I think the best plastic surgery, as I say on the channel, whispers and doesn't scream.
My 18th birthday, I booked in to get my lips done. And back then, no one really did it.
I think there is some issue with people getting filler at too young of an age because that filler is going to migrate. It's going to build over time. Sometimes people chase the filler every 6 months with, refilling, and eventually it adds up. And eventually, even when you go to dissolve the filler, you still have some permanent changes to your actual skin and the other underlying tissues. And we talk about it in a recent video about these types of effects of filler that oftentimes go unrecognized and people don't think about them long enough, especially when they're 18 and going in for these procedures.
Then a nose, and now...
Your nose job's phenomenal.
Yeah, it's great. It's a great nose.
Thank you.
Great nose.
The man that did my nose has actually been struck off.
Well, he did yours all right.
So many have been struck off recently.
I think it's
Not
noses, Liv. A bad nose job can literally ruin your life.
Yeah.
Struck off. I don't know what they mean by that. Like, do they not operate anymore? I'm not exactly sure what they're referring to there. I mean, I personally stopped doing rhinoplasties a number of years ago because I wanted to focus my practice more on the hair and the lip type of procedures. But rhinoplasties can be great procedures, especially the functional ones where you're helping people breathe again. And the issue with cosmetic rhinoplasty is that you're making the nose smaller and smaller. Typically, I bet when she started, her nose had some more size to it. And as you make the nose smaller, you can sometimes cause these functional problems like difficulty breathing through one side or sometimes both sides of the nose. And that can be an issue for people. So there's always this kind of struggle with rhinoplasty, especially cosmetic rhinoplasty, on trying to appease somebody and have them potentially attain their ideal type of aesthetic, but also you want them to still breathe well, right? And if you don't want that for your patient, then you probably shouldn't be doing rhinoplasties.
You've already got an issue with yourself because you're going to get something done. You can't deny that. So then if you go and get something done and it goes wrong, the repercussions of that
mentally.
Also, it's much more difficult to undergo these revision rhinoplasties, right? It's harder to correct work that was done poorly. And so it's much easier to remove tissue from the nose than it is to rebuild it if too much was removed. So that is one of the issues with rhinoplasty. Rebuilding the nose and getting cartilage from, let's say, the ear or from the rib or from a donor, a cadaver essentially, is all complicated, right? Those surgeries are harder to perform. they're usually more expensive. So as with most things in life, it's better to get it done properly the first time.
I saw a girl have her nose done, and she ended up getting an infection, and the nose died basically, and she had just like no nose, and every 3 days she'd have to come in to get it dressed. Her boyfriend was sat with her the whole time, and
it's just so distressing.
Like, what the these are things that can happen though to anyone.
Yeah, and not enough of those risks are usually discussed in consultations and also on the internet, right? We always talk about these amazing nasal transformations or any kind of, facial transformation, but what about the risk that people are taking on and that the surgeon takes on each time that he or she performs this type of procedure? I mean, there are these real risks, and I think it's important to keep that in mind for people who are weighing the decision. Should I undergo this procedure? Should I wait? Should I not get it at all? People need to have some degree of appetite for risk before they undergo these cosmetic surgeries.
I just think if you're putting yourself on Instagram, you should perhaps admit to what you've had to do.
I don't know. I don't know.
This is a thread that I always come back to, and I've done the surgery programs.
I've watched all the programs.
So the way I've landed on it is that if we basically tell celebrities and influencers, we kind of tell people you have to tell us what you've had done. It's like we don't have a right to anyone's medical.
Fair. No, we don't.
What I don't like is when people do something like a lipo or something,
and then do a body
and then they're like on the gym, or it's like post baby, and it's like with the six pack, lipoed, and they're like, I just had a high protein diet. Because then I think what you're doing is you're duping people.
Yes.
Yeah, there's this balance between people's right to confidentiality, essentially, and their right to, not say exactly what they did to their own bodies. And I think that they do have a right to that, right? But also, if they're influencers or, sometimes these mega celebrities, they also have some duty in keeping people, first of all, overall safe, and informing, I think, people about some of what they're, in a sense, advertising, which sometimes is their own bodies, or it could be their own skincare or their own whatever. And if they're, exactly as this lady said, if they're duping people, well, that can be problematic. And is often, I think, unfair to their followers.
We talk about surgery quite a lot on the podcast, don't we? We don't always name the surgeon that we use, simply, literally, not because we're gatekeeping, simply because the accountability and the pressure on you then, if you recommend a surgeon and it goes, excuse the pun, up, then, it can come back on you.
And that's another good point, that it's not guaranteed that just because your friend or someone you saw online had a great experience with a surgeon, that you'll have the same experience. And it could be that the surgery is still done, professionally and well, and objectively it's a nice improvement, but maybe for some individual, with what they had in their mind about how they would look, or maybe what they communicated with the surgeon wasn't completely, in line with their final outcome, some people can be dissatisfied. From my perspective, I've learned that it's impossible to please everybody. I would say that some of my least happy patients over the last 6 years have had objectively some of the best cosmetic outcomes. And some of the cases where, someone actually had a real surgical complication, or things worked out in a way that maybe I wasn't completely happy with how it worked out, that individual was like the happiest person or the most reasonable person. So it's very interesting how this stuff actually transpires, and it's the same with any business. If you're a restaurant or a hotel or any business, right, you cannot make everyone happy all the time, and that's something that's been a hard lesson for me to learn, but one that I definitely had to learn quickly, running a business. And I think that's what they're also, in a way, getting at here.
Having had it done, we share post and pre-surgery tips on the pod and also on Patreon. We, at the live show, midway through the live show, we had a screen and we showed our awful mishaps with things. So I'm allergic to filler, and I had my entire jawline dissolved, and it went like
it was
I looked like
Bo
Bo Selector. So we shared them, and my eye got infected when I had my blephs, and I had a big elephant eye. So but we're honest about it.
And that's awesome, and that's probably why people love their podcasts, right? Because they seem to be their authentic, real self, and they're not afraid to talk about when things actually, went wrong. And I think that's very commendable.
With influencers going over to Turkey, I've seen people's journeys of this, and they're going like, oh, okay, so I've woken up from surgery and my boobs are amazing, I love them, here I am in the limo, And then 6 months later, they're selling a story to a magazine about how they've had a botched boob job and they're going somewhere else. Yeah,
Turkey isn't just big for hair transplants. It's also other procedures that they're offering there. And again, you have some good clinics, but you have a lot of places that are just looking to make money. And that sometimes comes at the expense of someone's actual health and their physical appearance.
If your facelift surgeon is giving it me for free, I'm tagging the absolutely. Yeah. But what I would do with it is I would share my journey and I'd say, let me wait until the results are done.
Yeah.
And I would make sure that within the contract it's stipulated that if I wasn't happy, I could be honest about my journey, which is quite risky for a surgeon.
Yeah, it is risky from my perspective to take on influencers. And we've done it in the past, most recently with Charles Gross and his lip lift procedure. But it can be a bit worrisome, to do that. You just don't know how exactly the result will turn out. And you don't know how the person will react to it. And if they have a massive following of millions and millions of people, then it's very easy for your reputation to get tarnished. It's also a good opportunity to get out there in front of lots of people if, for example, it works out well. But that's with any surgery. You can never guarantee that it's going to work out exactly to everyone's liking. So that is definitely risky from the surgeon's perspective.
I know people that have literally, like you say, took freebies.
Too late.
Signed a contract, they'll share every step of the way.
And then
6
fall
months
off.
later, they're botched, but legally they can't even tell. So then people are going there.
To get offered stuff.
I probably get a DM at least once a week from a surgical group.
I do
at
as
least
well.
once a week.
Yeah.
So, and I think people listening go, oh, it's all right if you've got your own money, whatever. But one, I don't think you should choose a surgeon because you can't afford another surgeon.
No, I agree.
Unless it's like medical, no one needs plastic surgery. Do you know what I mean?
Yeah, like we'll have like a wait list usually of a few months, right? And people get upset at us like, oh no, I want the surgery now. And it's like, well, this is elective cosmetic stuff. Like you should be willing to wait to have it done properly. And it always surprises me when people like argue with us and try to impose that they need their surgery ASAP. There's no emergency here.
With my boobs, I spent a fortune getting them done.
How much?
I think I paid like 14 for my correction.
That's a lot.
Because he's like one of the best. And I could have done it free, but I just thought the first time round I went cheap.
Yeah.
And I paid
You
for
buy
it.
cheap, you pay twice.
You buy
And
twice.
Cheap is usually the most expensive.
Actually, let's talk about the facelift because I know people will be obsessed with this.
Yeah.
You're 34. And how many weeks ago?
It was about 3 months ago.
3 months ago, you had
Full face and
facelift.
neck and lip lift.
Oh, interesting. Yeah, I mean, she's definitely young. This has been a trend that's been going on, I would say, over the last 5, maybe up to 10 years, but really I think over the last 5 years that people are getting facelifts done younger and younger. And I think that there are some situations where that might be warranted, but I think overwhelmingly it's a concerning trend to me because of a few things. One is that, these surgeries carry real risk, right? And you're subjecting yourself to that risk early in life when you still have many years of, work and productivity ahead of you and you just don't know. Are you going to be the rare case where there's a facial paralysis, a nerve type of damage? Are you going to have a bad infection that lands you in the hospital for a few weeks? These are real things. Bleeding, complication. If you have a neck lift, there's bleeding that can occur deeper in the neck, and that can lead to the need for a more emergency surgery for airway protection, for example. So real risks, and I think taking them on earlier in life can be concerning. Also, as you start surgery younger in life, the minute she notices that, hey, there's a little bit of a sag, it could be very minimal that most won't notice, but she'll notice it because even a year after her surgery, there's going to be something that settles down. So, I mean, how often are you going to repeat that surgery? What is the scarring going to look like on the surface over, the course of many surgeries? And also the internal scarring. And how will that internal scarring potentially increase your risk for these other complications as you continue to get more and more procedures? So I think that's something that isn't thought about enough by surgeons who are operating on, much younger patients, but also, patients who are getting these surgeries done. And the same goes, honestly, for most procedures that are done. How are people going to fare, not just a few years later, but like decades later? And that's something we still don't completely know. I mean, getting facelifts in our 30s is a very new thing. This isn't like it's been done for decades and, half a century like this. This is very new. So we'll have to track it and see how people do. do with time.
People are going to be like, what the f***? She's 34. This is insane.
Oh, I've had so much.
How did you end up in this situation where you're like, I'm doing a facelift. I'm not going to do, Morpheus and fillers and whatever. What made you go to that decision, which in some people's eyes is like extreme. So extreme.
And it is extreme.
I thought she was joking.
But I am extreme.
But she wasn't. It's no joke.
Talk to us how you got to that.
It, honestly, like from years of filling, dissolving, treating, new all this, I just had lost definition.
Yeah, and that's the thing. Remember, she started getting fillers, she said earlier in this podcast, at age 18. So age 18, she was probably getting it done for like 15 plus years, right? And then eventually, she started to see those effects of filler. And so had she not started the filler that early, she probably wouldn't have felt like she had to get a facelift at 34, right? And so again, the earlier we start on whether it's surgical or non-surgical cosmetic procedures, the more procedures overall we'll get as we, advance in our lives, and that will bring more and more potential complications. So mark my words, but that's what we're going to see as time goes on.
I didn't look like me anymore because I'd been filled out, put back in. Obviously, I was pregnant a number of times in a short period of time. And when you have got fillers and you're pregnant, fillers hold onto water. So my face was like massive.
I loved it.
And then I had this
great for me
double chin, which was not a good look. So I just was like, I need a facelift, and I went and had one.
And when you found your surgeon and you went to him and he saw how young you were and whatever, was he a bit like,
actually tell the truth, you were rejected how many times first?
I think rightfully so. I mean, I think, I remember when I was offering facelifts a few years ago, I definitely felt uncomfortable, when someone in their 20s or 30s asked me for a facelift, and my gut instinct was always to say no, and, you just need to wait. But now I'm noticing that a lot of this type of activity is happening and all around the world.
Every year I used to send him an email.
Like an ex-girlfriend, do you want me back yet?
Every year, pictures of me and an email. Hi. And I'd go like this on the pictures. So they looked really bad. Please. No, try again next year. No, try again next year. So it went on for 4 years. And then he finally went, all right then.
Yeah, you look.
So I was like, okay, great. And his prices had quadrupled in the 4 years. Well, you'll know with the America.
So he's starting at like £60,000 or something now. Yeah.
Facelifts are very expensive these days. I look out there and I'm like, well, maybe I should still be doing these surgeries. But no, I mean, I'm happy with my current practice, which, as you guys know, includes hair transplants, different types of hair surgeries, as well as lip lifts and lip surgeries. And I'm very happy with that focused approach. But yeah, for sure, some facelift surgeons are charging $100,000 plus, for a single procedure. And if you're adding on other blephs and lip lifts, then it's going to add up to more. I mean, that is the going rate for some of these elite type of facelift surgeons.
And then they ended up getting 4 centimeters off each side of my face.
That's insane. It does look, because I've seen you before.
Yeah.
Like, it does look good. Like you can't deny it.
You can't tell.
No.
Nobody would look at you.
No.
And especially at 34, because they think she's not that fucking mental. That nobody would look at you and think anything of the sort.
But I'm really happy with it.
Yeah, I mean, I think, look, she looks great. But I do wonder if she never had those injections in the first place, would she have felt the need to get this surgery now at 34? And that's something that I guess we'll never know, right? And that's just something for people to keep in mind.
What they were saying, though, is there's so many young girls now getting like lip lift and bleph because we all wore those fake eyelashes for years, and it weighs your eyes down.
Shut up.
No way. Like it's not natural. And then the filler weighs your lip down.
That's true, without a doubt.
But also keep in mind the latanoprost that sometimes is in some of those serums and like for the eyelashes and eyebrows that people use. It can reduce the fat content around our eyes, and sometimes then that leads to people wanting to do more to rejuvenate the periorbital or that eye area.
Where are your scars?
So in front of my ear, and then
they're not though, are they?
There's
There's nothing.
No, it's mad, isn't it?
And the lip lift,
Yeah.
you did that as well.
Yeah.
Really, actually, you probably did need that looking. I didn't know.
Yeah.
Why did you say so before? Don't do the lip.
I was just a bit like
scared.
I was scared that I'm all for it. If she wants it, absolutely fine. I thought she was fucking crackers, but fine. But I was a bit worried that the facelift might be quite a shock, and then the lip lift as well. She might not recognise herself, and it might just be a bit much. But she was right.
But you do still look like you.
Yeah, I mean, that's the thing about surgery. If it's done well, you still end up looking like yourself. And with injectables, sometimes it's not quite like that, especially when they're not done tastefully. But injectables can work if they're performed tastefully and, in the right hands. And it's interesting what her friend brought up about, doing these procedures together, lip lift and facelift, versus maybe just doing one at a time and then seeing how you do. And there's pros and cons, right? On one hand, if you couple them, you have a single recovery, and that could be a good thing for some people. But if you do too much too soon, you may not be completely pleased with your new appearance, and then it's hard to step it back, especially when you've had a surgical change. So it's a bit more risky, but of course they can be performed simultaneously. And that's why I think, she said her surgery took 9 hours, because to do a facelift, deep plane properly with the neck lift like she had, and to add a lip lift, yes, that can take 9 hours. And if she was under anesthesia, that's a lot of time to be under anesthesia, and some people want to add, brow lifts and this and that. So it can be a lot of surgery to do all at once. So it's something to consider and to talk to your surgeon about, whether or not you should break them down into a few different sessions, months or years apart, or just kind of go for it and subject yourself to that increased risk of potentially prolonged anesthetic in a single session.